So let's be absolutely clear. People are dying because of these choices, and NHS staff have been warning about them long before COVID. Because there's a pattern here. The Royal College of Nurses tell us there's not enough nurses, the government deny it. Emergency medicine doctors say that delays are causing deaths. No acknowledgement of that from this government. Consultants are telling us that hospitals need at least 1,000 more beds to keep up with demand. This government cut beds by 1,300 over the last decade. And patients are telling us of long delays at A&E, and the Health Secretary's answer: tell patients not to go to A&E. The problem here isn't patients or staff. The problem is this out-of-touch and hopeless government that is presiding over a crisis in our NHS. So I ask again, what will it take for this government to act? Why does this government believe that they know best and not the nurses, the doctors and the paramedics on the front line of our NHS?
Deputy First Minister.
I'm afraid Mr Sarwar is absolutely in denial about the impact of COVID on our National Health Service. That is the problem in this exchange. Mr Sarwar seems to think that the challenges we face in our National Health Service today are somehow unique to Scotland. Every single healthcare system in the Western world is facing the same problems, yet, apparently, according to Mr Sarwar, the impact of COVID is irrelevant to that process. I am not going to accept that skating past situation that we face. The government has made the investment to engage in discussion with trade unions, with employees, with health boards, with the ambulance service, to make sure we have all the capacity in place to deliver on these services. But what we have to recognise, and that is why the government is taking the cautious steps that we are taking about COVID, some of which members of this Parliament tell us not to take, that some people are not prepared to support us when we take those steps. We do them to protect the people of this country, and will make no apology for doing that.
Move on to supplementary questions, and I call Emma Harper.